PerfectYou presents 7 signs your kid might be depressed. Kids are a hard nut to crack. It's like walking through hellfire trying to raise a kid with mental and emotional stability. Kids are sensitive and fragile. They tend to take every little thing at heart, and sometimes it gets the best out of them. But children make our lives colorful. To keep them as cheerful as they are, we must look after them and see how they're doing emotionally and mentally. Your little ones deserve to be happy. If your kid suddenly seems a little sad and bothered, how can you know if there is a problem? Today, we are sharing 7 signs with you to see whether your kid is depressed or not. When your teen snaps at you for having to say hello to them in the morning and wakes up mad at the world, it can be easy to dismiss this behavior as normal adolescent moodiness. What may seem like an attitude problem may be a sign of depression. It can be hard for parents at times to tell the difference between a typical response to everyday stressors and true depression. If you've noticed a consistent change in mood or loss of interest lasting for 2 weeks or more, you should consult a professional. It's typical for children to feel angry and sad sometimes, or when someone is clinically depressed, is feeling sad, irritable, lacks interest in enjoyable activities, and perhaps even feeling hopeless for most of the day, the majority of the days. In children and adolescents who are depressed, you may notice more irritability and loss of interest. It will be more than just sadness or a depressed mood. With depressed children, you may see an externalizing response, such as frequent temper outbursts or aggressive behavior. So, without further ado, let's get into the 7 signs. Number 1. Withdrawing from friends and family. Kids love to mingle with their friends and family. They are usually the first ones to get excited when there is a family gathering. If you see your kid suddenly hiding away from the crowd, this can be an alarming sign for you. If he is depressed or feeling down, he will isolate himself from the rest of his family. This behavior often gets unnoticed as parents are busy running around doing chores. If you see your kid not wanting to play with his friends or wanting to stay in his room or alone, it can indicate that your child might need help. Do not scream at your kid when he refuses to contribute to the family gathering. Give them space and talk to them gently about how they are feeling when they are ready. If this does not work, then try talking to a therapist. Number 2. Weight loss, weight gain, changes in appetite. Changes in your eating habits may be related to other symptoms of depression, such as fatigue and a lack of pleasure from activities. Many people with depression lose both energy and interest. This can include a loss of interest in eating. This may be especially true for young people or kids with depression who may lose interest in eating and don't have the energy to chug a glass of milk. For others, nausea may be a symptom of their depression and cause a loss of appetite. The loss of appetite is a symptom of depression, but overeating can also be a similar symptom. When patients eat in response to their emotions, they are soothed by the food as it changes the chemical balance in the brain that is more comfortable than on an empty stomach. It can also improve mood through positive association with happier times. If you see your kid not eating or overeating, this might be another sign that they are depressed. Number 3. Self-harm. Deliberate self-harm is a behavior in which a person commits an act to physically harm themselves with or without a real intent of suicide. People can use several self-harm methods, most commonly cutting, poisoning, and overdosing. Children generally scratch or even bite themselves. Children and adolescents with intellectual and developmental disabilities are also at risk for various self-injurious behaviors. You should develop a habit of checking your kid's body and behavior to detect any alarming signs of self-harm. It is a sure sign that your kid is depressed. The best way to prevent this is to communicate with your child. Provide them with a comfortable environment where they can express their concerns openly to you. Number 4. Changes in sleeping habits. Depression and sleep are closely connected. Almost all people with depression experience sleep issues. Depression and sleep issues have a contrasting relationship. It means that poor sleep can contribute to depression and that having depression makes a person more likely to develop sleep issues. This complex relationship can make it challenging to know which came first, sleep issue or depression. Kids have a very similar pattern of sleeping and waking up. If you start finding the difference in that, it might be a cause of concern. If your kid is going through depression, he might sleep too much to avoid his thoughts or stay awake all night thinking about his problems. You should keep a close check on their sleeping patterns if you want to find the problem. Number 5. Fatigue or loss of energy. Everyone gets tired, especially after busy days, hard work, late nights, illnesses, and exercise. But a depressed child may always lack energy and motivation. Even after an appropriate amount of sleep, a depressed child may complain of being tired, moving slowly, or taking a disproportionate amount of time to complete a task. You may even notice him slacking off on his daily activities. He might not even want to play with his friends anymore. It can be very alarming if it becomes a habit. A child is full of energy and is always excited to try new things. Imagine you're telling your kid that a new ice cream flavor came out, but he shows no interest in it. It may seem weird to you and you might ignore it. This can certainly mean that your kid might be depressed. Number 6. Aggression and being impulsive. For some depressed children and adolescents, their emotions may cause them to feel angry towards people or things they believe are the sources of their pain. This can lead to impulsive and aggressive reactions. Impulsive behaviors are quick reactions to events, usually negative, without regard for consequences. Impulsive behaviors often, but do not always, lead to aggressive actions. Aggressive behaviors may be directed inward in the form of self-injury or at someone or something else through angry outbursts, harassment, property damage, or even violence. Kids are usually very carefree and they often go around making a mess of themselves, but sudden anger outbursts which become a habit are a clear sign that your kid is depressed. Number 7. Feeling sad all the time. Children may become sad about many things, such as lost relationships, schoolwork, failures, missing out on something, moving, or the loss of a friend, a pet, or a loved one. Try to identify what your child is sad about and provide support. If symptoms of sadness improve or disappear after just a few days, they are probably not related to depression. Depressed children may have a general sense of sadness about their life and their future, or they may not be able to identify what they are sad about. They may cry a lot or tear up frequently for no obvious reason. Feelings of sadness that last longer than 2 weeks are a reason to talk to your child's pediatrician or consult with a therapist. Childhood depression is a complex condition that has many causes. Several different factors can contribute to the onset of depression in children. Depression affects many children. You do not need to panic over it, but try to find out the reasons behind it. Remember that you should be the first person that your child comes up to when they're having a problem. You should provide your kid with a safe environment where they can be themselves and have nothing to hide. Kids need to know that there is help available when they need it. Give them a list of people they may talk to, such as yourself, a teacher, or even a counselor. It may seem small to you, but what counts is how it feels to your child. Listen and be a source of support. Be aware of the impact your responses to life are having on your child. Your child learns coping skills by watching you. It can be hard to know whether your child is depressed or having a mild reaction to a negative event, but you are not alone. Many parents struggle with understanding what their child is thinking and feeling. Fortunately, there are many ways to find support and treatment. We hope that this video was helpful. And if you want more informative videos like this, let us know in the comments section below. Do not forget to like, share, and subscribe to our channel. And hit the bell icon so that you never miss out on our uploads.